Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Well, prostate cancer is the most common cancer among men, affecting 1 in 7. But it can often be treated successfully, and a screening event is coming up at Retreat Hospital to help you learn more. We have Dr. Andrew Colhoun, who joins us from Retreat Hospital. Thanks so much for being with us.
Sure, absolutely.
First, let's just talk about what are some of the symptoms, who's at risk for this?
Well, the funny thing about prostate cancer is there really isn't any symptoms until it can get very advanced. So it's important to start screening early. All men, usually between the ages of 40 and up, depending on your risk factors, should start getting screened.
Let's talk about the risk factors. What are those?
So the main risk factors that we know to date right now are your family history. So if you had a father or a brother that were diagnosed with prostate cancer, that puts you at higher risk. Other thing is racial risk factors. So being black or African American, those men are at much higher risk of prostate cancer than Caucasian or white men or Asian men. So they should definitely be getting screened at age 40 if you meet one of those risk factors.
Okay, and so is 40 pretty much the guideline for people to start with the screenings?
So if you don't have one of those higher risk factors, you can start around age 50,
Okay.
but age 40 for men with one of those risk factors.
Okay, you guys have an event coming up to help educate people about this, and people can get screened, so let's talk about that.
Sure, so it's an annual event that gets put on at Retreat Doctors Hospital. It's coming up on September 20th. There'll be a lecture by one of the doctors that works at Retreat talking about prostate cancer and prostate cancer screening. And then they'll also be doing blood draws for PSA, which is the main test that we use to diagnose prostate cancer, and also doing physical exams as well.
Okay, and that's Thursday, September 20th, 5 to 7 p.m. at Retreat Hospital. And the key that you want people to know here is this, again, can be treated very successfully. It's all about screening and catching it early, right?
That's right, exactly. Most prostate cancer is slow growing. There are a few low percentage that are more aggressive, and we want to catch those. We want to catch all of them, at least know about them, but the majority of them may not require aggressive treatment.
Okay, thank you so much for being with us, Doctor.
Sure,
We appreciate
absolutely.
it.